said it so well. Senator Stabenow said it very well. Senator Klobuchar and I have been teaming up on this for years and years. And let me just give you a couple of additional thoughts. When you're talking about getting a good deal for patients and taxpayers, everybody knows you're supposed to be able to negotiate. You ought to be able to negotiate to use your bargaining power. There are more than 50 million seniors. You've got a lot of bargaining power. But the pharma lobby was able to secure a holy grail, and they've been protecting it. And the holy grail said, we aren't going to negotiate. We're just going to decide what all the AARP members and everybody in Minnesota and Michigan, what they're going to pay. They're going to make the decisions. The 50 million people, who cares? They can negotiate with everybody. Shoot, everybody negotiates with grocery stores. My God, but you couldn't negotiate. So they had this holy grail. And the three of us, under the leadership of Senator Schumer, kept coming back to the floor and saying, no, we're not going to accept the system on health care costs where basically if these guys want to sell it not just way beyond inflation, but 10 times the inflation rate, they can get away with it. So the fight was all about taking Big Pharma's holy grail away. And because of these wonderful people, all the grassroots and Brad and everybody, we left that holy grail in tatters. We walked off the floor and it was dead. It was gone. It was over. From now on, we're going to negotiate. And as Senator Schumer said, we're just getting started. Now, when we set up the inflation penalty, and Senator Stabenow, I'm still trying to talk her out of retiring. She sits next to me on the Finance Committee. We said, let's put this into English here. Inflation penalties, all the rest. It's more than just an inflation penalty, although that says it very well. It is a price gouging penalty for the first time in America. We're going to hit the Big Pharma lobby with price gouging penalties. So, what you're starting to see, and I would refer everybody to the wonderful material that Senator Stabenow and her staff puts out. Drugs, for example, like Humira, which is a blockbuster cancer drug, you're going to see lower co-payments, lower out-of-pocket co-payments for all the members of the AARP and everybody else. So I'm just going to close with this. In my youth, I was co-director of the Gray Panthers, senior citizens group. I had a full head of hair and rugged good looks and all that. And all of us have been telling you these stories of watching for years on end senior citizens in particular, but lots of other people, in pharmacy lines. And they'd be waiting and waiting, and you could see them. They were counting the money they had, and they were looking at their checkbooks, and people were saying, am I going to cut the pills? Am I going to buy a piece of chicken? Am I going to go without? Those were the stories. And so the three of us, under the leadership of Senator Schumer, we had a bunch of other people in our caucus. We dedicated this fight to them. We said, for all of you seniors and all of you people who've been getting fleeced all these years because you haven't had any bargaining power, this fight is about you. And Joanne and AARP and all the senior groups took to the grassroots. By the way, there are lots of people, executives and stuff, in all these buildings, all around here. You know, building, doesn't say building for higher prices for senior citizens or something, but that's what they're doing. They're trying to say, oh, you know, we won't have any research, and oh, everybody, the companies will move to China, and oh this and oh that. They were fighting all these people all the way. And so when we walked off the floor of the United States Senate a year ago, it was pretty simple. The people beat Big Pharma. God bless. Wonderful work.
Senator Klobuchar.